right, hi everybody. I'd like to welcome you to the follow-up session for the Better Health Research Theme Community Seminar that we did on the 18th of June, 2018. We had a really nice Twitter response to our meeting that evening, and we didn't get to address all the Twitter questions. So I've reassembled our, academics, and we're going to address those Twitter questions now. So we had a couple questions asking about the health and nutrition focus on the new campus, and we know that food and food innovation is going to be one of the central themes of the new campus. We have Sandy Murray here with us who could speak to that. Sandy, would you like to talk a little bit about those comments?
Yeah, no, thanks, Scott. And as Scott just said, health and human performance, as well as nutrition in the form of food and agriculture, are two of the main themes for the new campus. And I'll speak to the food and agricultural perspective of it. So right now I'm part of an informal group called the Food Systems Innovation Group, and it consists of myself as a staff member at University of Tasmania and members from our agricultural centre, as well as external stakeholders from Ferment Tasmania and a variety of other groups who represent food industry in I guess the north here. And we've been talking a lot about what will food look like on the new campus. And part of the conversation has been about ensuring that access for community and for students is available and there. So we've talked about community gardens and what that might look like. I'm not quite sure, but we've talked about community gardens for student and community access, community kitchen access, food cooperatives, those types of things. So they're part of the conversation, and whilst I don't, again, know what they would look like physically on the ground, they're still part of that mix. So we're excited that that will be integrated somehow within the new campus structure.
Can I just say, just from an educational point of view, that it would, I just sort of have this vision of all these, future health professionals of various disciplines going out into their communities and, encouraging the use of community gardens. So I think it's more than just being about a community garden for the campus, but actually role modelling, I guess, what's possible in communities across the state. And so, I trust that it'll be used as an educational opportunity as well for our students.
I'll just add to that as well, Kath. I mean, a community garden is really a means to a healthy outcome. So community gardens provide a learning platform, just like a classroom with four walls, to actually learn about, how to grow food, how to pick it, how to harvest it, how to cook it, and actually provide that social inclusion opportunity for people as well. It provides physical activity, access to vitamin D, of course, if you're in the sun. So it has so many other benefits. So whilst we talk about community garden, it's kind of more than that. It's really just the bedrock of so many other benefits to community members that otherwise wouldn't be available. And if I had my way personally, I would love to see community gardens in every suburb, across every small town in Tasmania. They provide that great opportunity for improving health and well-being. So you're right, Kath.
Sounds like a grant proposal, yeah.
Yeah, it does.
I'd say so.
Yeah.
Going on from that, Sandy, Gary Fetke had a post on the Twitter feed that night asking about student garden and better food options that are going to be on the new campus. Do you have any influence in that decision making, or?
Yes, so what I can tell you, so following on from the conversation we've just had about the theme of food and agriculture, I recently have been talking with colleagues from Tasmanian University Union, so TUU we call it, as well as our student advisor groups across the Newnham campus, and we're very aware that there are students who are food insecure, so students who are going hungry on campus. And it's not unusual, but it's quite hidden and we don't talk a lot about it. So we're now starting to talk more about what are the opportunities for improving access to good, healthy food for our students, improving their health and well-being, and ultimately improving their experience at University of Tasmania. So some of the things we're starting to look at, and hopefully models that we can move to the Inveresk campus, are looking at things like food cooperatives. So we have a health and wellbeing week coming up in October this year, and I have some students looking at developing and launching a pop-up co-op food shop for students. So we're going to be running a food can drive very soon. Whilst canned food is shelf stable, and some people might think, oh, I don't know about that, at least it's shelf stable food. We're also going to be asking for staff and community members to bring in local produce as well that they might have in excess. So we're going to start that pop-up shop come Health and Wellbeing Week, and we hope to, if the model works, we hope to be able to move that over to Inveresk campus as an example. We also are resurrecting the community garden here on campus at Newnham.
Oh, nice.
For the third, fourth, fifth time, but we think we now have a model that works really well. And the challenge is always volunteerism, because students routinely leave to have their lives in November, and then come February they come back again. So that's perfect growing season where the garden's not used. So we're putting some processes in place to support this. We've also got opportunities with the TEU to get some free frozen meals off the ground using surplus food that would otherwise go to waste, perhaps through Second Bite or other food rescue organisations. And I'm just looking at my list of amazing things that we had happening. Also, the IT students from computing are developing an app for access to food. So if there's an event that's happening and there's foods that are available, then they're going to identify where that food is, where the event is, and advertise it. So, and then when there's produce available on the trees in the orchards here at AMC, the Australian Maritime College, then again that will be advertised. So
Cool.
There's some real amazing opportunities happening. So we just need to move those forward and really start to evolve this fair food movement here on campus. Excellent. Which is pretty exciting.
Yeah, right. Sandy, when we get this all set up on Twitter and YouTube, you could post all that stuff in the comments section. Great. So that people can link to it then, and we can publicize it. That'd be great.
Yeah, good.
Nice. So Sandy, that sounds like great ideas, but it sounds like it's going to need a little bit of funding behind it. And we actually had a follow-up question from Gary Fetke as well, asking about the Healthy Tasmania 5-year strategic plan, and is that funded properly to be able to hit all these goals that we're trying to achieve? What do you guys think about that?
Look, I've got something I can add to that. Look, fundamentally what we know is good food and access to good food is really important to actually reduce the burden of diet-related diseases such as type 2 diabetes, heart disease, cancers. And also what we know in Tasmania is we're kind of leading the way really in Australia, and we want to reverse that. So improving access to good healthy food is really important, and that leads on to thoughts for me around the issue of food insecurity, which is when you don't have access to good healthy food. It's not a life choice. Here in Tasmania, we've got some folks who perhaps have some of the lowest incomes that have to afford to buy good healthy food, and if they don't live where the food is or can't afford to get to the food, then they won't have access. So more monies in prevention is going to be really important if we want to tackle it from a food perspective, and there's other perspectives as well, in terms of physical activity as well. So we need more support and infrastructure in terms of helping to alleviate these diet-related diseases and lifestyle-related diseases.
And education, grassroots level, like to break that cycle. You just see the pattern continuing because people aren't getting educated, or again, you know, they don't have access to healthy foods. To think that there are some communities where you cannot go and buy fresh fruit and vegetables. How do we expect, you know, people to be able to eat healthy and, you know, access healthy food and cook well when they can't even get to the food. So access is a big thing, particularly in the nutrition area that Sandy's pointed out, but also to understanding the role of physical activity and embedding it into school. Like, they actually take out physical activity the further children get along in their school education, whereas it should be an integral part. And that doesn't have to be in a competitive sport setting. It needs to be around movement and that is movement and play, and that is a really valued, important component of the curriculum.
Yeah, absolutely. And following on from that, in terms of the physical activity aspect, we've had some really good programs in this state, Active Launceston, for example, which were publicly funded education programs, activity programs to try and encourage people to become more physically active and impart the health benefits that we know exist. One of the big issues, and it's not just through Active Launceston, but wider through many of these initiatives, is that they only last as long as there's funding, committed funding, and unfortunately, often in the design of them, no one actually thinks about how, or properly funds how to evaluate them. And so the thing that's really lacking is that we've got all this evidence from Active Launceston that there were increases in physical activity and activity awareness. But what we should be looking at as well in the evaluation is what effect did that have on health outcomes of people, and how did that affect health budgets potentially? Because I think a very strong argument could be made that these sort of approaches are very sustainable, will save governments money in the longer term, but we're not collecting the evidence in many of these at the moment to actually confirm or disprove that point.
That's right. Prevention is a super important point, but you got to have the evidence to show that prevention works. It can't just be.
I think we do have a lot of evidence, though, that is, we're gaining momentum in that space, particularly around the effectiveness of accredited exercise physiologists and how much money they can save per year if patients are undergoing treatment. And not only do we have the largest health problems here in the state, but we've got that then as an opportunity that we are a small state relatively. So, and there's so much expertise here that can influence the health outcomes of Tasmanians that we need to capitalise on that and leverage it for the best outcomes. And a lot of that comes into then those high level discussions and government really placing an importance in funding preventative health.
That's right. And you talked about the education side of it. So the evidence is starting to come out of the labs and the clinics, but it's that translational element that gets it into the people's ears and gets it into the policymakers and the government to be able to, that's kind of where we're at, aren't we? We're finding the evidence, but we're not quite there to that government.
Absolutely. We don't even have accredited exercise physiologists employed within the public health system here in Tasmania. Which is absolutely crazy when you see the cost benefits for treatment by accredited exercise physiologists.
Well, hopefully this interdisciplinary approach that everybody keeps talking about can start to put together evidence from multiple fields, and maybe that'll get us across the line.
And can I just come in quickly? I'm probably just reiterating points, but I agree that the translational research is the issue at the moment. So, there's a lot of evidence for these interventions, but it's actually how do you do it and how do you actually implement them in our community. I think, Andy's point that there's all these fantastic programs that aren't properly evaluated is really problematic. And, wouldn't it be nice to actually just have an evaluation body, someone who, a group or an organisation who are able to put evaluation frameworks around these small programs, because the small programs are just never going to be able to do it for themselves. And it just occurred to me when you were speaking, Andy, that wouldn't that be a lovely, to have a unit sitting within the university, which was a program evaluation unit for health and nutrition programs that actually could just come into all of those different small programs and evaluate them effectively. And so I think, it's just a challenge because it's the translational research that's not being done. And the reason it's not being done is because it's a whole variety of small programs that need to be evaluated, and we don't have the capacity to do it.
Yeah, if that could be resourced appropriately, that's an incredible investment then in working out the most effective way to improve Tasmanians' health. And I think with bodies like Healthy Tasmania, that is their mantra and their charter to improve the health of Tasmanians, that then really needs to be that relationship building, and particularly then with the incorporation of expertise in health modelling and economic modelling that's available potentially through UTAS.
So it sounds like, so the 5-year strategic plan is a good start, but it needs to go further.
Okay. All right, we had several questions about what the campus setup is going to look like when we move to the Inveresk campus, in particular around the exercise clinic that's already a functioning heartbeat of the Newnham campus, and how that's going to look when we move there. And there was also a question about the gym, so I think I'll turn it to Andy first, and who runs the exercise clinic. And what are your hopes and aspirations, Andy, for moving to this new campus regarding that?
Well, thank you, Scott. Look, I think there's a lot of things to consider about the exercise clinic at the new campus. I should preface this by saying that the university is currently doing a review of how the exercise clinic is working on the current campus, with a view to coming up with some recommendations about how it will look moving forward to Inveresk. My personal opinion is that I think it's working really well at the moment, but we've probably reached capacity in the space that we've got. The goal has always been to try and provide services through the clinic for clients where services aren't provided elsewhere in the community, so that we're not competing with private enterprise or private providers, but we're providing a health service where it's needed. I'd like to see that being the case going forward, but I'd also like to see it expand a bit to provide additional opportunities for not just the exercise science, exercise physiology students, but students from a range of disciplines, because I think there's an opportunity that's being missed at the moment to provide really good multidisciplinary learning opportunities for our students and multidisciplinary services for the general public. So I guess in an ideal world, what I would like to see is that there is more input within the current clinic, rather than it being an exercise clinic as such. It's an allied health clinic, and that we have input from dietitians, physiotherapists potentially, that there's opportunity for nurses and nursing students to come in and do assessments of clients, that we've got an opportunity there that pharmacy students might be able to come in and look at medication reviews for clients as well, and potentially also our medical students coming in and having an opportunity to learn about what the allied health professions do and how they work, so that when they graduate, they're actually better equipped and have a better understanding of what's going on. So for that to happen, probably we need some more space, and we also need a really organised plan about how all of these professions will come together and students will get opportunities.
Yeah, nice. Okay, we have a question for Dr. Mai Frandsen. They wanted to know, how do you monitor smoking cessation, Mai?
Yeah, sure. So this question came up because of the work we've been doing paying people to quit smoking. And so, of course, one of the most common questions is, yeah, but people can just take up smoking to be part of the study and or the intervention and get some dollars. Firstly, we know that doesn't happen, because smoking is usually a lot more expensive and obviously really something that you don't want to do than the incentives or the rewards we're giving them. But of course, we have to get people to verify that they are not smoking as part of these studies or interventions. And the easiest way to do that is to get them to blow into something called a carbon monoxide monitor. And I should have had one with me, but it's about this big and it looks like a breathalyzer, but it's not. What it does measure, though, is the amount of carbon monoxide in someone's system, in their breath. And carbon monoxide is basically what's found in smoke. And so if you are smoking cigarettes, you're more likely to have carbon monoxide in your system. The reason that's such a great way of telling us about whether someone's smoking or not is that it gives us immediate feedback. So obviously things like urine or saliva are very, very accurate in telling us whether there's nicotine in someone's body, but it takes longer and it's more intrusive. This is quick, blow into it, and it gives you feedback. So of course, any time that we're giving someone a reward for not smoking, we have to verify that. And even just in getting that biofeedback straight away, we know a lot about biofeedback, is really a great motivating tool. And we are looking at actually bringing these monitors into GP practices, into hospital systems, so that not only do we give people feedback on their blood pressure or their blood sugars, we can also give them feedback on how much carbon monoxide is in their system, and whether that's because they're smoking themselves or someone else around them is smoking, or other pollutants. So carbon monoxide, it's great, and that's what we use.
Well, you kind of lead to another question that we got there too, Andy. The idea that the School of Medicine, which functions mostly in Hobart, but also up here in the Newman campus, what's their capacity for having some type of exercise prescription class being a part of their learning? And you think that's valuable? And I know, Cecilia, you probably have some thoughts on that. What do you think, Cecilia?
Oh, I was just thinking any evidence-based science where there's, clear reason to employ those techniques in improving the health and for prevention and management of disease, that should be a component of what medical students are exposed to in their undergraduate degree. Now, exercise, we know, is medicine, and there's certainly scope to improve exposure to exercise, improve education around the benefits of exercise and the importance of it in the prevention and treatment, particularly in the chronic disease space. And so I think within medicine, just as there should be nutrition, there should be components around the importance of exercise, but also around understanding what other allied health professionals do and who the experts in exercise prescription are to refer to. Now, there's a lot of evidence that supports that GPs recognise that it is important, but maybe don't talk to their patients about it or prescribe it because they don't have the skill set in that area. So it's not necessarily making our doctors into exercise physiologists, because that would be another 4 years of study they'd have to undertake, but making them aware of referral pathways and experts that can assist their patients and be part of that multidisciplinary team in a healthcare approach. So Andy's comments around having a multidisciplinary clinic fits that model beautifully, and that way the person that benefits the most from that is the patient, the end user, and we're addressing all components of their health in a holistic model and making sure that all the treatments they're receiving are evidence-based and effective.
Yeah, that sounds great. Fortunately, we have a GP on our panel today. Dr. Kath Ogden, would you like to contribute to that comment?
Yeah, sure. Look, I agree with everything that's been said, that obviously exercise and also nutrition are incredibly important for the health of our patients and of the community. And unfortunately, I guess historically haven't been incorporated in a full way into medical curricula. So that's something that is of a challenge, because the medical curricula is very full and it's very difficult to get new things into it. But obviously, this is of importance, and so I would fully support investigating ways of incorporating the skills, exactly the skills you've talked about. I don't think doctors need to be experts, they just need to understand the benefits and then be able to refer to the appropriate people. I think, if you wanted to be strategic, I think one of the things that medical curricula and also other health science curricula are crying out for is interprofessional learning opportunities, and the regulatory bodies are ensuring that we're looking for opportunities for interprofessional learning. So I love the idea of the interprofessional exercise clinic, but also I think we could think of a variety of ways that we could implement interprofessional learning into curricula, and it doesn't have to be a kind of standalone model. It can actually come in existing curricula, so on clinical placements, to get students working together and understanding what each other does and what their skill set is something that I think shouldn't be that difficult, but it does need to be resourced, and it needs to be driven as well by by probably everyone, but also, dare I say, from you guys, to be actually really trying to help us to implement some of these opportunities rather than waiting for the medical profession to do it themselves. I think it's fine for there to be some sort of activism from outside to say, hey guys, let's do this. So I see interprofessional learning as the vehicle for bringing this into medical curricula. And I think, you know, as a group in the north anyway, we have a great opportunity to try and think about how we can progress that vision.
I agree, Kath. I think that you know, this presents an opportunity, and it's nice that, you know, the full move's not going to happen probably for another 3 to 4 years. So there's time to plan. You mentioned the plan. You mentioned the plan. Kath's mentioned the plan, and there's scope to do this now, and precedent, which is nice. I think it looks good for the future.
Yeah, and I would hope that the move to Inveresk, even though it's just a physical move, but in a sense it does give us the opportunity to revisit how we do things. And so I think, you know, we need to take that opportunity to think about how we can perhaps work together better. And, you know, we're sort of a little bit out of the scene from where you guys sit. And so I, you know, welcome the opportunity with these discussions to actually start to sort of work together and a little bit more. And so if the move precipitates that, that's great.
Yeah, that would be a fantastic outcome.
Yes.
Yeah.
Great. And I think from the community perspective, we'd like to hear from you as well. So this Twitter feed and this YouTube channel allows you to post comments, and any support that you can provide of your thoughts and feelings about anything we're talking about today, please, the support helps, and it'll help us keep a conversation going for the next few years.